What's exciting about FAST is that it's a novel SCS MOA that allows us to provide patients with a version of paresthesia-free pain relief that works rapidly in the clinic. And patients don't have to wait 2 or 3 days for the wash-in and see what happens. I mean, we're all here because we're trying to help patients have the best quality of life and reduce their level of pain as much as possible. And it's exciting to see this new SCS MOA come around that allows us to see it happen in the clinic in front of our eyes and patients to see it happen rapidly.
One of the things that excites me about the new Alpha platform is that of the fast therapy. It is a therapy that is able to achieve pain relief very quickly. And so we're not waiting for this wash-in effect. Beyond that, this is backed by science and a neurobiological principle of surround inhibition that we know works in other aspects of the nervous system, but has now been applied to the spinal cord in order to obtain pain relief.
So to tell you the truth, the first time I heard about FAST, I was a little bit skeptical, but seeing it work in several of my patients, it convinced me that my principle of less is more is actually very true. The data was supported by the computational model from Professor Grill at Duke, and it showed very good results. And really, my clinical experience showed that this programming is actually very good for our patients.
There are two things that excite me most about FAST. Number one is having the ability to treat my patients with a device that really reduces their pain beyond my expectations and their expectations. Now, I've treated 15 patients so far, so it's a fairly small cohort, and I'm excited with reservation. But if I can capture the next 20, 30, 40 patients and have them be anywhere near the 15 or so that I've treated right now, I would be enthralled. The second thing that excites me is the mechanism of action. We finally have something that answers how, or explains rather, why we can significantly decrease a person's pain. And I think that this can change how we learn and educate people in our field and our patients. And it changes how we think about pain.
You know, when I had the opportunity to use FAST on patients, I had one in mind that I had seen that week previously who just was not doing really well with her spinal cord stimulator. We had seen her multiple times, done multiple programming options. So she was at the top of my list. And we brought her in. She was reporting back and leg pain of about 7 out of 10. Programming to put the FAST programming was done pretty simply and efficiently. We put it on. She got up. She started walking down the hallway in my office, and about halfway down the hall, she turns around and said, "My pain is a 1 right now, and it's unbelievable." I will tell you, I was pretty skeptical when I first heard about FAST programming, but we've reproduced it in our practice over 25 times, and it's a pretty incredible advancement in neuromodulation.
I first became excited about FAST programming when I got to see it in action. A patient recently came to me who had been frustrated that his stimulator wasn't working as well as he had hoped. He had had it implanted for post-laminectomy syndrome and still had a pain score of 7 out of 10 that involved his back and his left leg. I asked him to give me a little bit more time to optimize the programming before we removed the system. We started FAST programming, and immediately in the office, his face relaxed. He told us that his 7 out of 10 pain score reduced to 2 out of 10 very quickly. I had him come back to the office several weeks later and even several months later. And each time I've been thrilled that his pain relief has continued.
So my clinical experience has been very good with FAST thus far. I've had 8 patients who came into my office quite unhappy. And essentially asking for us to explant their spinal cord stimulators. I was lucky enough to be one of the first in the country to have FAST at my disposal. So we converted them over to FAST upon their visits. And every one of those patients was excited again about having their spinal cord stimulators. Now, I say this with cautious reservation because though it's been 8 out of 8 so far, I don't know what's going to happen with my next 8, my next 20. But so far, the results have been very, very promising.
I started using FAST back in October. I remember a patient, 80-year-old male. He had low back pain, right leg pain. He was walking with a cane. Pain was an 8 out of 10 on a daily basis. His main goal was basically to reduce his pain and walk without his cane. So we trialed him in October. We started in with FAST. And I do remember in clinic, as soon as we trialed him, he got up. He had 80, 90% relief in his pain symptoms, walked without his cane. He felt great. He had a successful trial. We went on and implanted him. We used the linear 8 contact leads, put him on a FAST program, and immediately post-op, again, he got up, walked without his cane, had 80 to 90% relief in his pain symptoms. It was just very impactful to me to see him achieve his goal of walking without his cane, immediately got pain relief, and felt great with the paresthesia-free program.
You've heard a lot about FAST, but I'd like to show you in this video an actual patient. This is a patient who came in with a pain score of above 8, and within a few minutes was able to achieve an NRS score that was around a 0 or a 1.
Can you let me know when it goes away one more time?
It's gone.
Going right there. Can you tell me how your pain is right now?
I don't feel my pain.
Okay. Can you tell me a little bit about that? As far as when you said you were at what level 1 through 10 when you came in today?
When I came in today, I guess this morning when I got up, I guess I was at a 9 because it wasn't on. You told me not to put it on.
Yep. Okay.
Okay, I turned it on when I seen you walk through the door, so I was at about a 7 when I came back here.
Okay.
So.
And what would you say you're at 1 through 10 right now?
Probably a 2 or 3. I don't feel nothing.
Okay.
I don't feel anything.
You're not feeling any of your usual pain right now?
No.
And did you feel it kick in a little bit faster compared to programmings in the past?
Yes.
Okay.
And I felt myself walking a little faster in the hallway.
As you're able to see, her gait improves, she's able to function better, and clearly her satisfaction has improved significantly after enabling FAST.